Go.
Hi, Patricia and Tessa for Group 10 presentation. Problems of program evaluation. We're going to be looking at treatment fidelity. And the scenario that we came up with is an inpatient rehabilitation program for clients with substance use disorder that recently implemented a new evidence-based curriculum for cognitive behavioral group therapy occurring 4 days a week. However, given staffing shortages, the therapists who are facilitating the curriculum were not properly trained in doing so. For this reason, it has been discovered that most of the therapists have not been using their treatment manuals as instructed due to confusion. The first decision that will need to be made regarding the evaluation of fidelity in this CBT program will be the type of evaluation design that will be utilized. Given our intention to determine treatment fidelity, we propose that a process evaluation design would be the most appropriate fit. According to Royce, 2016, a process evaluation primarily aims to describe, monitor, and evaluate the effectiveness of a program through quality assurance. So with this in mind, it will be decided that a process evaluation aligns with the evaluation of the program being examined in our scenario. According to Royce, 2016, various factors must be considered when determining if a program is being implemented in true fidelity. Among these factors are adherence to the treatment protocols, therapist competence, and treatment differentiation. To ensure treatment fidelity to the cognitive behavioral therapy group for clients with substance use disorder, it is in an inpatient facility setting. We need to make decisions as to these components, if they are or are not being met. So we want to look at the evaluation design, the adherence, the therapist competence, and treatment differentiation.
Okay, so what we're going to do now is we're going to break down the different sections regarding decisions that will need to be made for this evaluative process. So, as group facilitators, we're not utilizing their treatment manuals as instructed. Problems regarding the fidelity to which the intervention is being implemented is clearly lacking. So, we will need to make decisions that relate specifically to staff training, likely an increase in staff training, dosage hours. Program evaluators will need to ensure that clients are receiving the correct number of dosage hours for group each week. And then we'll also need to decide if attendance records are being kept, group sign-in sheets are being filled out each time to ensure that clients are attending and remaining in group for the full frequency and duration. We would also want to consider if the group is occurring, like I said, at the frequency and duration that it should be to make sure that things are being done to true fidelity. The next factors that we would want to consider for decision making would be therapist competence and treatment differentiation. Regarding therapist competence, something we know is group facilitators in this scenario were not properly trained in the cognitive behavioral curriculum being implemented. Therefore, it's highly likely that they are not skilled and have minimal competency related to the facilitation of this curriculum. So something we would want to decide is how do we increase levels of competency, and we'll need to determine how we do that. If that looks like additional training, quality assurance reviews, so on and so forth. We also want to take a look at treatment differentiation. So given the examined scenario, the level of treatment differentiation is unfortunately considered unknown prior to evaluation, but we hope to figure that out through the process. So the first thing we would want to decide and consider would be if the program that is being examined directly resembles other programs. We would also want to determine if findings are directly resultive from the cognitive behavioral intervention that's being offered. And then we would also want to determine the quality of supervision for providers. If we note that supervision is lacking, we would need to decide how to plan for regular and ongoing supervision. What we hope to learn from the evaluative process. So, according to Toomey et al. 2020, previous research has historically shown investment in evaluating the overall effectiveness of programs, but less consideration has been given to why or how interventions do or do not work as intended. Similar forms of literature discuss the importance of understanding the value and worth of a program and planning for improvement where needed, which is evidenced in the literature of Balmer et al. 2020. And literature also suggests that training to promote the facilitation of treatment groups to fidelity is imperative, which is found in the literature of Baker et al. 2023. From this evaluative process, we hope to learn the degree of calibration to which this program intervention is being delivered and its intended purpose. We hope to determine the overall worth and value of the cognitive behavioral group being evaluated. And we hope to also identify areas for improvement regarding program fidelity and program impacts and efficiency. And lastly, we hope to learn about how program facilitators can be properly supported in efforts to enhance their level of competency. In this next section, we will talk about alternative methods for program assessment. So, according to Varela et al. 2023, key performance indicators, which are also known as KPIs, are utilized to ensure the overall quality and effectiveness of an intervention through various measures, including but not limited to the monitoring, observation, and management of groups. So we would be considering using key performance indicators to determine if or if not this cognitive behavioral therapy group being studied is meeting its performance goals as intended. Given the scenario, KPIs could be utilized to determine if the CBT intervention is meeting standards of true fidelity. The next thing that we would consider for an alternative method to evaluate this program would be observation. So Royce et al. 2016 additionally indicates that direct or indirect observation of treatment interventions can determine if groups are being facilitated to fidelity and what may need to change to make this happen if it's not. And then finally, an alternative way of assessing this program may include quality assurance reviews through which established protocols and standards are considered and compared to the intervention being offered. And the final slide we have here is our references, and we have taken the time to explain why each of these references is going to be recommended for our peers. So the first reference, which is Baker et al. 2024, is recommended for classmates as it emphasizes the significance of taking steps, including but not limited to quality training in relation to improving treatment fidelity. The second reference, which is Balmer et al. 2020, is recommended for classmates as it clearly identifies specific procedures for program evaluation, such as being purposeful when implementing program evaluation designs, and discusses the overall intention of evaluating programs. The third reference, which should be probably pretty familiar to all of us, is the Royce textbook, and this is recommended for classmates as it provides a wealth of knowledge pertaining to program evaluation design and implementation. The fourth reference that we've utilized is Toomey et al. 2020, and it is recommended for classmates as it provides feasible recommendations for enhancing treatment fidelity, primarily in behavioral health interventions, which may be useful to social work practitioners. And the fifth and final reference, which is Varela et al. 2023, is recommended for classmates as it clearly identifies key performance indicators that are reflective of treatment fidelity across various disciplines. And this is our presentation. Thank you.